about 8 years ago, my daughter was diagnosed with a rare form of cancer. They don't even know what kind it was. And 6 weeks later,
in 2003, I lost a grandson who was 16. His name was Heath, and he had leukemia.
Well,
So
I followed
came-
Lucy's lead. I thought that I would have the capacity to do inpatient care,
Just
and I
need
began
to
the
give
training.
back from all the things that hospice did for myself and my husband.
The reasoning I'm doing it, if you want me to point that out, was my wife worked here for 22 years.
My husband was in the hospital for 2 weeks prior to coming to hospice.
Years
And it was
ago,
just-
before I retired at the end of 2009, and before I retired, our pastor at our church said that you would probably do good at volunteering at hospice.
And so I came to Pathways when it was here at Good Drive, and came to a loss of a child group from Pathways.
and 6 weeks later, she was gone. But in the meantime, she came up to hospice. She got here on a Friday. She passed away on a Sunday morning. And the people here were so nice. I had a volunteer came in and just asked me if I needed a hug, and I did.
I had thought about volunteering, but I didn't at that time. And then 2.5 years later, in July of 2005, my husband suddenly passed away in a work-related accident.
And I began the training and quickly found out that I didn't have quite the temperament to deal with dying patients. So I thought I could do something else, because I knew there were about 50 different categories of volunteers.
And it was just a horrible experience, but once we got here, it was just so peaceful, and my family could come in, and I do have a lot of family.
So we had nobody to serve in the Green Thumb capacity. Lucy had already been doing some Green Thumb work with the roses and weed pulling. So I started working with Jim Weisensale.
Well, I think like pay it forward philosophy.
For 22 years, she asked me to volunteer, but I was always, I had a job, So my wife passed away last year, and I decided that I would come aboard and do vet visits.
My own mother, back in the 90s, was in hospice care in New York, and she got such wonderful care there.
So I figured once I retired, I would check it out, and lo and behold, I do basically office work more than anything, but that's what I do, and I've been happy with it ever since.
The reason I'm really with hospice is because I remember a saying that says, "Do unto others as you would have them do unto you."